Hello, I'm Dr. Laura Herrera Scott, the Secretary for the Maryland Department of Health.
And I'm Anthony Woods, Secretary of the Maryland Department of Veterans and Military Families.
We are here today to talk about some of the ways our agencies are working to support veterans, active service members, and military families in obtaining services and other challenges they may face in civilian life. Thank you for joining us, Secretary Woods. I know we are both incredibly passionate about the veterans that we serve through our respective agencies. Can you talk a little bit about your military service?
Absolutely. For me, it started when I went to West Point. I was raised by a single mom who worked as a housekeeper, so military service was going to be my pathway to a better life. As our governor often says, I knew deep down that service would save me. And so I went to West Point and then served for 5 years on active duty in the Army. So I did 2 deployments to Iraq. Now I currently serve in the Army Reserves, so I get an opportunity to serve 1 weekend a month, 2 weeks a year, which has really helped inform me and how I think about the work that I do with my department. And how about you?
So I have a long history. My stepfather served in Vietnam, lots of cousins and uncles that have served in the Army, and so it was a natural progression for me. And I signed in right before 9/11 to the Army, and I was an Army Reservist for 10 years and deployed 3 times from 2004 to 2008 in support of Operation Enduring Freedom and Operation Iraqi Freedom, but only one of those was overseas in Iraq. Could you tell me a little bit about the services your agency provides to veterans and their families?
Yeah, absolutely. So I like to think about our work as supporting veterans at sort of key transition points in their life. And so that can start when a service member is transitioning off of active duty. And so one of the most important things that we provide and one of our biggest programs is our Veteran Benefits Program. And so what we do there is we actually help veterans go through the process of obtaining their VA benefits. We also sort of meet people at sort of various points throughout their journey as a veteran. And so we have a long-term care facility in the form of Charlotte Hall. And then at the end of a veteran's life, we want to make sure we provide an eternal resting place that honors the service and sacrifice of them or their dependent. And so we have 5 cemeteries across the state where a veteran can be buried for free, along with their spouse. One of the things that I find most fascinating is our work with the Maryland Veteran Trust Fund. And so if a veteran or a dependent has fallen on hard times, we can actually provide an emergency one-time financial grant, which helps to prevent things like foreclosure or eviction or car repossession, helps them have utilities turned back on. So the area that I'm most proud of is the work that we do around the governor's challenge to prevent suicide amongst service members, veterans, and their families. And that's work that your department and my department, we work on together. And so that has been an area where I think that collaboration is really powerful. It's so important. Something I'm so glad our state has invested in and you see as a national effort is 988. If a veteran, a service member, or their family is experiencing a mental health crisis, this suicide prevention line, they know they can press 1 and they'll be immediately connected to a person who is trained in military cultural competency and can understand the challenges that somebody might be experiencing if they're military connected.
And veterans getting specific care unique to their experience is incredibly important. So we feel incredibly fortunate that 988 is not only available, but there is the press 1 option so that a veteran can speak to someone who understands their experience.
And one thing that we've learned through our experience is that when a veteran is connected to VA healthcare, they are actually 80% less likely to die by suicide. And so that's why we think it's just so important that our veterans be connected to their healthcare benefits. And so they can go to our website, which is veterans.maryland.gov. We'd be glad to support them in gaining access to the benefits that they've earned and connecting them to VA healthcare.
Secretary Woods, I think you know that we accept calls from veterans needing help, and we take referrals 24 hours a day, 7 days a week. We coordinate with national, state, and local organizations to improve services and empower individuals. But we're also doing a lot around training and educating providers to ask the question.
Exactly.
Because then you can do those additional screenings with questions such as related to deployments or any of the things that you might have seen while deployed. So it's incredibly important, and my team here in the Behavioral Health Administration absolutely values the partnership we have with your agency.
I think the most important thing I want anyone watching this to know is that we're here to help. And if you need services and are having difficulty in getting answers, please get in touch with my office. We have veteran benefits specialists that are accredited by the U.S. Department of Veterans Affairs to assist in filing claims and navigating the system. Bottom line, you are not alone, and there are folks here to help you navigate the veteran benefits system.
Thank you, Secretary Woods, and I want to second that and remind you to please reach out if you or a family member needs support for mental health challenges such as depression or substance use disorder. Sometimes the strongest and bravest thing you can do is ask for help. No veteran, active service member, or military family member should ever go without the services and support you need, which you've earned with your loyalty and dedication. We are honored to support all of Maryland veterans, active service members, and military families, and we thank you once again for the sacrifices you have made.
Thank you for your service to our country, and have a happy Veterans Day.